Oh, I'm so angry right now. I just did a video and I don't think it recorded properly. And I don't think it ever comes out naturally the second time around. I hate repeating. Oh, okay. This topic is, first of all, thank you everybody for all your comments and support regarding my dog that we had to have put down. I am getting back into a new routine, sort of settling in, keeping busy with some things. My sleep's much better now that I don't have to get up and early and do his things, but I still miss him and feel a little thrown off. And another announcement is that I don't know when I'll be able to upload this because my laptop crashed, virus or something. This topic is something someone asked me to talk about a long time ago, and I'm sorry it's taken me so long to get to it. I should probably sit still. And it's about changing medication changes. So basically, when you're being treated for bipolar disorder, medication changes is a fact of life for most people, especially in the beginning when you're discovering out of the many medications which ones work for you, which ones you don't have bad side effects for, treat your symptoms, because we all fall under the label of bipolar disorder, but each of our situation and symptoms or illness is unique to ourselves. And so the medications must be tailored to our unique situations, and that takes time. And because sometimes you do notice for a lot of medications these days an immediate response. It can take weeks for a full response, and for benefits and for side effects to go away. So this process in the beginning requires patience and time, and people get really discouraged in the beginning a lot of times, and this is when a lot of people, I think, give up on the medication, maybe because initially the first one or two they started with was a bad experience for them, or a doctor they were working with was a bad experience, and they just didn't, just gave up, got discouraged and gave up right away. But two things is that there are so many different, first of all, there's several different groups of medications. You've got your mood stabilizers, your antidepressants, anti-anxiety, antipsychotics, doing so many different things. And the combinations are just endless. Also, the difference between a good psychiatrist and a bad psychiatrist is huge, especially when it comes to prescribing medications, which is what psychiatrists really, it's what they do. Look at your symptoms, treat them. And I'll get into the bad psychiatrist a little more later, but it's a huge difference in the beginning. If you have a bad psychiatrist that's not doing the medications properly, doesn't know the pharmacology, and isn't keeping up to date, then you're going to have a bad experience with that doctor. And when I have experienced both, and the difference is just like almost like a religious experience, you know. It's like, wow, I didn't know it could be this good. Even when I was frustrated and we were trying different things, I could tell that this doctor knew what she was doing in the medications. Okay, so reasons why, besides in the beginning discovering what meds you need, reasons why you might need to change medications are side effects. Either side effects that are just simply intolerable to you, you know, like sexual side effects, or weight gain. And a good psychiatrist takes that seriously. They won't, you know, well, the medication works, so you have to live with some side effects. I mean, yeah, I'll live with dry mouth, maybe a little constipation, but weight gain for me is a big deal, and my doctor understands that. So, and another one would be is, say the medication is what they call contraindicated with another illness you have, or on other medications that you have to take. And that means that a medication might make an illness you already have worse, or might cancel out a medication you have to take, or make it work differently. And I can't really think of any, like, one thing I can think of is an example is if you have liver disease, you might not be able to take, like, say maybe Depakote, I think, because it is processed quite a bit in the liver. So that's what that is kind of like. And like some medications can like cancel each other out or make one work more and then end up dangerous. You know, like say maybe makes your blood, if you take something for blood pressure and to make your blood pressure lower, and you take a new medication that makes your blood pressure lower too and causes that to make a dangerous situation. So that's another reason why. Another reason why you might have to change medications, and this is the sad part, is if you say something happens with your insurance and you can't afford it. Sadly, it's a fact of life. Like right now, I'm trying to be independent. I'm on disability. And I take Seroquel XR. And Seroquel, regular Seroquel has a generic, but not the XR. But Seroquel, regular Seroquel does not treat my irritability. And it causes a very, very unpleasant side effect. It makes my heart beat really hard. And so I pay a lot for that medication out of my pocket, because there's also another one for my irritable bowel that I do. And I'm just getting around to living off of my disability by myself, and there might come a time when that changes and I might have to sacrifice and go back to the regular Seroquel that has the generic, which is sad, but that's just how it is. Okay, I'm going to stop here and carry on to a different, and my little light's not blinking. I bet I'm not even recording. I'll finish in another video.